PPEC's yearly employee orientation. Orientation will be held for all newly hired employees. Rehired employees after 12 months of leave of absence. Also, it is an annual refresher orientation for all active staff in direct contact with participants. This is according to Aspen ACA STQ0480 in-service training staff self Q0490 R 59A13.013, 2-3, 59A13.013, 1, AC. All employees will have available a copy of the Center Employee Handbook as required by PPEC regulations. As required by the PPEC regulations, following the survey, all employees must be aware of the following administrative aspects. An organizational structure is the system that outlines how roles, responsibilities, and authority are arranged within a company or organization. It establishes reporting lines, communication channels, and workflow, helping employees understand their duties, who they report to, and how different departments or teams work together. A clear organizational structure enhances efficiency, accountability, and coordination, ensuring that the organization operates smoothly and achieves its goals. All employees must be familiarized with the organizational chart posted at the PPEC Center. The philosophy means the administration's beliefs and values, and that we must all share them for the center's success. All employees must know the center philosophy, which is visibly posted at the center. All employees must be committed in sharing the vision and mission the organization will take to achieve the goals for the participants and their families. The mission and vision is clearly posted at the center and also available in the Employee Handbook. They are provided with information on all policies and procedures according to the child care policy adopted by PPEC and those specific policies tailored to the population served. This includes incident management, fire safety, transportation, nutrition, rules of conduct, and others that are available for review at the Administration Office and the DON, Director of Nursing, Office. The administration informs you that, as staff, you receive guidance on OSHA regulations, ensuring that all precautions are taken to protect the health and safety of participants and staff, thereby avoiding negative consequences. Florida labor laws provide basic protections for employees while maintaining workplace flexibility. The state follows an at-will employment doctrine, allowing either the employer or the employee to end the employment relationship at any time, provided the reason is lawful. Florida adheres to federal overtime standards, requiring eligible employees to be paid time and a half for hours worked over 40 in a workweek, and enforces a state minimum wage that is adjusted annually. Employers must also comply with anti-discrimination laws and maintain workers' compensation coverage to protect employees in the event of work-related injuries or illnesses. An Employee Non-Disclosure Agreement (NDA) is a legal contract that requires an employee to keep an employer's confidential and proprietary information private. It typically covers trade secrets, business strategies, client information, and internal processes, both during and after employment. The purpose of an NDA is to protect sensitive information from disclosure or misuse, helping the employer safeguard its business interests. Assignments and duties are defined by an employee's job description and the organization's expectations. The job description outlines the specific tasks, responsibilities, and scope of the employee's role, while organizational expectations establish standards for performance, professionalism, and conduct. Employees are expected to carry out assigned duties competently, follow policies and procedures, collaborate with team members, and adapt to reasonable changes in assignments that support operational needs and quality of service. Direct and indirect supervision refer to the levels of oversight given to an employee while they perform their job duties. Direct supervision means the supervisor is physically present or immediately available to observe, guide, and give real-time feedback during tasks. Indirect supervision happens when the supervisor is not constantly present but remains accessible for consultation, guidance, and work review, usually through scheduled check-ins or periodic evaluations. Both types of supervision ensure accountability, safety, and quality performance while helping employees work independently. An initial employee performance review is a formal evaluation conducted around 90 days after a new employee begins work. This review assesses how well the employee has adapted to their role, completed assigned duties, and met organizational expectations. It typically covers job knowledge, quality of work, productivity, attendance, teamwork, communication, and adherence to policies. The purpose is to provide constructive feedback, recognize strengths, identify areas for improvement, and set goals to support the employee's continued growth and success within the organization. An annual employee performance review is a comprehensive evaluation conducted after 12 months of employment. It assesses the employee's overall performance, including job knowledge, work quality and consistency, productivity, teamwork, communication, problem-solving, and adherence to organizational policies and standards. The review highlights achievements, identifies areas for improvement, and sets goals for professional development and future performance. It serves as a tool for feedback, recognition, and planning, supporting both employee growth and organizational success. A notice of probation status is an official document that notifies an employee their performance, behavior, or conduct falls short of the organization's expectations. It details specific concerns, the length of the probation period, and the expected improvements during this time. The notice also describes the support provided, monitoring procedures, and potential consequences if performance does not improve, serving as both a warning and an opportunity for the employee to address deficiencies and demonstrate progress. Most of the training are conducted online, with some delivered through in-person sessions or in-house orientations. The following list specifies each training and indicates whether it requires certification or is provided as an in-house orientation. Most of them are training with attestation by the PPEC consultant or the Director of Nursing DON. 1. OSHA, University/Infections or HIV training with certificate. 2. HIPAA, confidentiality training with attestation by PPEC consultant or DON. 3. Medical errors are only for RN and cannot for HHA training with a certificate. 4. Current CPR certification training with certificate. 5. Non-discrimination policies, procedures, and implementation, linguistic, cultural, and gender diversity. Training with attestation by the PPEC consultant or DON. A notice of temporary suspension status is a formal document that informs an employee that they are being suspended from work, usually due to a serious policy violation, a safety concern, or an ongoing investigation. The notice details the reason for the suspension, its length, any conditions for reinstatement, and expectations during this period. It aims to protect the organization, ensure workplace safety, and give the employee a clear understanding of the situation and the next steps. A notice of termination of contract is a formal document that informs an employee their employment is ending, whether voluntarily or involuntarily, in line with the terms of their contract or organizational policies. The notice generally states the effective date of termination, the reason for ending employment, details about final pay or benefits, and any necessary steps the employee must take before leaving. It clearly communicates the end of the employment relationship while ensuring compliance with legal and organizational requirements. 6. Patient Bill of Rights training with attestation by PPEC consultant or DON. 7. Management disposal of biomedical waste training with attestation by PPEC consultant or DON. 8. Procedures to report incidents in the facility, training with attestation by the PPEC consultant or DON. 9. Procedure mandatory report of child abuse and neglect, Florida Administration Family and Children, training with attestation by PPEC consultant or DON. 10. Emergency procedures. Training with attestation by PPEC consultant or DON. All outsource and contracted personnel must adhere to the employer's administrative working policies while inside the center and in direct contact with the participant to facilitate services and maintain health and safety practices. The attestation statement indicates that I have carefully read and studied all the content of the Employee Orientation Handbook. Are made responsible for completing all mandatory training required for the practices of my job and profession, according to AHCA regulations, STQ0480 In-Service Training, Staff Requirements, STQ0490 Rule 59A13.013, 2-3, 59A13.013, 1, AC. This training provides initial and annual guidance on the PPEC Center Employee Handbook. Please read and review your copy carefully. If you have any questions or require clarification, do not hesitate to contact the PPEC consultant, the administration team, or the center's Don. Thank you for your cooperation and participation. Dr. J. G. Padin, PPEC Consultant. padinagabriel@gmail.com